Hello, welcome to NDPERS Pre-Retirement Education Program. Today we're going to go over the NDPERS retirement insurance options. Insurance is often what keeps us working longer because maybe a person has met their rule for retirement, but needing that insurance benefit is what's keeping them working. Today we're going to cover some of those insurance options. Any of our retirees in any of our 9 retirement plans or retirees in the teacher's retirement or in the TIAA higher ed can come on our insurances when you leave employment and begin to draw a benefit. Anyone that begins to draw a pension is going to be offered dental and vision, whether you had that as an active employee or not. For active employees that were enrolled in our Voya life insurance, there will be some options to continue that. As far as surviving spouses go, if you're receiving an ongoing retirement benefit at the time of the retiree's death, continuation of that may be an option. Additionally, for those that are not receiving an ongoing retirement benefit, may also be eligible to continue the NDPERS insurances. Keep in mind, this excludes the life insurance. During this presentation, we're going to go into more detail in the health insurance options, what our dental and vision plan is, and also for those that are eligible for the life insurance. One thing to keep in mind as a retiree is there is no open enrollment in retirement. As an active employee, we are all used to annual enrollment where you can make those changes. As a retiree, this is not the case. There needs to be a qualifying event, and then you're eligible to apply within 31 days of that qualifying event. The coverage will become effective on the first day of the month following the date of the qualifying event. If you or your spouse do not elect coverage during a qualifying event, you may forfeit your right to enroll in a plan at a future date. So your date of retirement might be the last day of your active employment. If possibly you're deferring your retirement, you terminated, but maybe you're not going to take that for another year, then that would be a qualifying event because then you're beginning your NDPERS retirement. If you receive a non-NDPERS retirement plan, such as TIAA or TFFR, provide verification that you are on that alternate retirement plan, then also you're going to have that 31-day time frame. So other qualifying events are going to be you or your spouse becoming Medicare eligible or turning age 65, or let's say if you were covered through your spouse's employer group plan and you had a loss in coverage due to that plan, then that could change it as well. This also includes loss of coverage due to the death or divorce from a spouse, as well as completion of the COBRA continuation coverage. For example, you took COBRA for 18 months, and then you're going to lose that coverage. Again, that would be loss of coverage of that health plan. Additional qualifying would be marriage, birth, adoption, or legal guardianship. Next, let's cover those health insurance options at retirement. If a person is not Medicare eligible, they may consider going on COBRA. What is COBRA? COBRA stands for Consolidated Omnibus Budget Reconciliation Act. This is a federal law that provides many workers with a right to continue group coverage in their health plan. The federal law applies to employers with 20 or more employees, including self-insured employers. So keep in mind, it's going to be the same insurance that you've had with your current provider. Generally, COBRA is only allowed for up to 18 months. Now, there are certain cases for disability where that can be extended. And you will pay the premium directly. Now, of course, we all know that can be quite expensive. So other options might be enrolling in your spouse's health insurance. Or people can go to the marketplace. What happens after COBRA? Let's say you took the COBRA insurance for 18 months and then that terminated. If you or an eligible dependent are not Medicare eligible, you will need to find other coverage until you or an eligible dependent become Medicare eligible. There is insurance through the federal exchange at www.healthcare.gov. That is just basically the federal government's marketplace insurance. Please note, NDPERS does not assist with any sort of insurance options available through the federal marketplace. If you or an eligible dependent are Medicare eligible, then let's talk about the NDPERS retiree health insurances. One health insurance option is called the One Medicare Plus Other Plan, also referred to as One Medicare, One Non-Medicare, or One Over, One Under. Well, what does this mean? The One Medicare means there is the member or an eligible dependent that is Medicare eligible. They have come on Medicare Parts A and B, so they need to pick up a supplement and drug plan. This Dakota retiree plan is that supplement and drug plan with NDPERS. The others are going to be the non-Medicare dependents, and they will be enrolled in the state of North Dakota Sanford Dakota plan. This is the same insurance that active state employees and some of the political subdivisions that carry our insurance have. Again, that Dakota retiree plan is going to be the supplement to Medicare Parts A and B, and then also Part D, the prescription drug plan. These are bundled. You must enroll in both. It's really a take it or leave it situation. You take our Medicare supplement and drug plan, or you say, no thanks, I do not want that. But in order for that others, that non-Medicare dependent or dependents to come onto the Dakota plan, you must have both of these. We're going to discuss this further in the next slides. I mentioned the One Medicare Plus Other or Others plan, but what exactly does that mean? Again, it's the Dakota plan, the same insurance that state employees and some political subdivisions have through NDPERS. Whether it's single coverage, family coverage, it's going to be those exact same deductible, coinsurance amounts, and out-of-pocket maximums. It's also going to include the $250 a year wellness benefit. So for example, the person that's retiring with NDPERS is Medicare eligible. They're going to go on that Dakota retiree plan, and then they have their spouse who's 2 years younger and not Medicare eligible. And maybe by chance, they still have a dependent child in the household. That is going to cover those other two. That's the others that are in the plan. The Dakota plan includes coverage for preventative screening services up to $200 per covered individual per year. For these services, the deductibles will waived. Once you reach that $200 maximum, any preventative services are subject to the cost share based upon the plan. So some of those benefits are going to include routine physical exam, a routine diagnostic screenings, and some routine screening procedures for cancer. Let's review the Dakota plan prescriptions. Again, this is going to be how the prescriptions would work for that non-Medicare person or persons. The Dakota plan includes prescription drug coverage, which has 3 levels of coverage based upon the medication in which tier or group it falls under. The tier level is determined by Sanford Health Plan. If you are taking a formulary generic medication, your out-of-pocket cost would be $7.50 copay and 12% coinsurance. Formulary brand name medications have an out-of-pocket cost of $25 copay and 25% coinsurance. For formulary generic or brand name medications, there is a $1,200 coinsurance maximum per covered individual per calendar year. Non-formulary medications have the highest out-of-pocket cost with a $30 copay and 50% coinsurance. Coinsurance for non-formulary medications do not apply towards the coinsurance maximum. There is also mail order options available for NDPERS members. Please contact Sanford Health Plan for additional details. Again, I would encourage you to visit our YouTube page where there's great insurance shorts that will further describe the PPO basic grandfather plan. Again, the Dakota plan, which would be that non-Medicare person would be on. In addition, there's the other health and wellness benefits that will be described and educate people on what's available to you when you're on these health insurance plans. Once you're Medicare eligible, Medicare is the primary insurance, so they are driving the bus. Medicare will pay first, then the supplement insurance kicks in. We bundle our supplement plan with a drug plan. That's through Humana. Typically, if you are in the US and you are getting service that is covered by Medicare, between Medicare and your NDPERS Medicare supplement plan, you will have no out-of-pocket expenses. Now, with regards to the drug plan, any plan that you would be on, there's always going to be out-of-pocket expenses with that. Let's look at how Medicare and Dakota Retiree Plan work together. You sign up for Parts A and B through Social Security Administration. They pay first. They are your primary insurance. Oftentimes, they pay roughly 80%. That's why people pick up a supplement plan. In our case, it's Stanford Health Plan, and they're going to pay second after Medicare. You cannot be enrolled in secondary insurance if you don't have the primary insurance. So first step is getting that Part A and Part B. You go to the doctor, you're going to give them two cards. You give them your Medicare card, then you give them your Stanford Health Plan card showing that is your supplemental insurance. Thirdly, you need prescriptions. You have your Humana drug card, and then that is what you're going to use to fill your prescriptions. Just to reiterate, the Dakota Retiree Plan is going to be the Sanford Health Plan, and that's your secondary coverage, your supplemental coverage through Sanford Health Plan. Typically, if your service is covered by Medicare and you're at a facility that accepts Medicare, you're going to have zero out-of-pocket costs between what Medicare and the Sanford Health Plan kick in. If you needed to get information on specific coverage, you would want to contact Sanford Health Plan. They would be able to give you detailed information as far as coverage goes. And again, the third piece of that is going to be the drug coverage. Think of D as for drugs, okay? Part D through Humana Group Medicare. You're always going to have some sort of out-of-pocket expenses based on which tier your prescription's in. Prescriptions may change tiers by the pharmacy benefits manager with guidance from the Federal Drug Administration and Drug Enforcement Administration. Each year, NDPERS posts their comprehensive prescription drug guide if a person is needing to look further into medication and coverage. Let's look a little further into that Part D through Humana prescription drug coverage. There are 4 tiers of drugs based on the list. Let's say, for example, you're taking a Tier 4 specialty tier medication. Your medication is $100. In this case, you would pay $25 and then 50% of the remaining cost share. Keep in mind, this is a plan only until the end of December 2024, and our website will be updated with the new information for 2025. Due to the Inflation Reduction Act, there are going to be several changes that are going to require changes into these plans. Again, follow our website under the Retirement tab for the latest information. If you needed to get specific information on costs and prescriptions, you would want to reach out to Humana directly. Our plan name is the Humana Group Medicare PDP plan. There's an 800 number, and they also have a website. NDPERS is unable to help with specific questions as we take the premiums for these, but we don't administer the plan. Keep in mind the Dakota plan, again, is only that non-Medicare person, if on COBRA or the others. The Dakota retiree plan is going to be the Medicare eligible person only. We have a lot of great information on our YouTube page regarding this too. There's a video about insurance choices before retirement that's specifically going to go more into what this plan means. Next, let's talk about the group dental plan through Delta Dental. With Delta Dental, these are some of the coverage highlights. First, let's talk about the premium. Whether it's the employee or member or retiree, it is going to be the prices listed to the left. Simply, you want to come on as a retiree and you had this as an active employee, same exact price, $41 a month. Now, of course, these prices are subject to change as we change these plans. It will include a $50 deductible per person per year, but please note it doesn't apply to the diagnostic preventative services. Those are covered at 100%. Basic services, endodontics, periodontics, oral surgery, prosthetic repairs and adjustments, 80%. Major restorative, prosthetics, orthodontics, 50%. There is a calendar year plan maximum of $1,000 per person and a lifetime orthodontic maximum of $1,500 per covered dependent. Additionally, some features of this plan are there's going to be no waiting period. Let's say, for example, you terminate sometime in the month of September. So you're an October 1st retiree with NDPERS. First pension payment would become November 1st. Your plan would start with that first pension begin date. And there would be no waiting period. So November 1 hits, you can begin to use this insurance. There is no age limit on orthodontic treatments. The out-of-pocket savings if dentist is within network are also going to be helpful. And if you need further information, you can go to deltadentalmn.org. This is also helpful to see if you have an in-network provider, although just contacting your provider can be very helpful in making these determinations as well. Now let's go over the group vision plan provided by NDPERS. Some of the plan highlights with the Superior Vision insurance plan include one per calendar year for exams, frames, contact lens fittings, eyeglass lenses, and contact lenses. As you can see, the copay for eye exams is $0. Materials copay is going to be $35, and the in-network allowance for frames, $100. For contact lens fittings, $35. And in lieu of getting the glasses, the in-network allowance for contacts is $100. The premiums for this, for the employee or the member, retired member, would be $5.03 a month. Employee and spouse, $10.06. Employee and children, $9.16, and employee and families, $14.19. These prices are subject to change. The vision plan coverage through Superior, again, is going to cover in full the exam. There's going to be retail allowances for the frames and then the contact. Now, keep in mind in-network versus out-of-network. So if you're seeing a eye doctor and they might be out of network, likely you will need to submit that reimbursement directly, and then those are the different fees that you can receive back. Again, I'm going to plug our YouTube page where specifically more detailed information on the dental insurance and the vision insurance. And each year, if this would change, we update these as well. Now we are going to discuss the Retiree Health Insurance Credit, or RHIC, which is a monthly lifetime benefit. This benefit was paid into on your behalf by your employer. We contract out with a third party called ASI Flex to administer this. On our YouTube page, we have a great video showing how retirees can claim that RHIC. Please note, not all retirees are eligible for the RHIC and is dependent on what your date of hire and/or when you came onto the NDPERS retirement plan. For anyone enrolled after January 1st of 2020, the RHIC is not part of their retirement plan. So when thinking about the RHIC retiree health insurance credit, these are the key words. It's going to be a reimbursement for any after-tax premiums, okay? Not expenses, premiums. It's important that you first pay the premium, then reimbursed by ASI Flex. Eligible after-tax premiums include health insurance premiums, vision plan premium, dental plan premium, long-term care premiums. Note, RHIC will not be reimbursed on subsidized insurance premiums. Well, what does that mean? That means if you went out to the marketplace, the Federal Healthcare Exchange, and got insurance, and in receiving that insurance, you got a federal subsidy to lower the cost of that premium, then you cannot also claim and get reimbursement for your healthcare credit. Let's talk about how the RHIC works. If you have NDPERS insurances, you came on the One Medicare Plus Other plan or the Dakota Retiree plan, the dental plan or the vision, we will automatically reimburse you. What happens? We will take that premium out of your pension check, or maybe you want to have it direct debited out of another bank account. We feed that information to ASI Flex, and then you're going to receive the reimbursement from them automatically. Nothing you need to do. If you have non-NDPERS insurances, you're going to need to submit a claim form for any after-tax health insurance premiums. For example, you're paying your Part B Medicare premium through Social Security Administration. There is a claim form that you can complete. You just need proof that you pay that. Each year, Social Security Administration is going to send you a letter showing you what your Part B Medicare premium is. You fill out the claim form, copy of that letter, submit it, boom, you're done for the year. Now, keep in mind, claims submitted after the deadline will be denied. The deadline is March 31st to submit for the prior year. For example, you retired sometime in 2024, you will have until March 31st of 2025 to submit reimbursement for 2024. Again, NDPERS contracts out these services with ASI Flex, so any retiree reimbursement questions should be directed to ASI Flex. And this is how you can contact them. Let's talk about NDPERS life insurance as a retiree. Retirees that participate in the life insurance plan as an active employee have the option to continue their basic employee, supplemental employee, dependent supplement, or spouse supplement life insurance coverage until they reach the age of 65, as long as the election was made within 31 days of the date of termination. Once a retiree turns age 65, they can only continue the basic life insurance coverage through NDPERS. Upon retirement, the basic level of coverage reduces from $7,000 to $1,500. That would be the payout upon death, $1,500, and the premium for that is $4.32 a month. At retirement, you will have some options. If under age 65, we will offer to keep your coverage and your dependents coverage until you are age 65. Now, the cost is going to go up a little bit as a retiree compared to what it was as an active employee. If over the age 65, then the only thing we offer is the $1,500 basic policy for that $4.32 a month premium. Now, Voya will reach out to you directly by mail regarding options to port that policy. It is with them and at their rates, and you can keep that till up to age 70. They will also offer for you to convert it to whole life. Again, that is between you and Voya. So some of the conversion rights with Voya. So remember, may apply for a conversion if you have that loss of coverage at separation. You're going to lose that term coverage because you're turning age 65 and also after separation of employment, and then loss of port coverage at age 70, okay, after separation of employment. Now, again, that whole life insurance policy, if you decided to convert that, no age limit. Again, those rates and conversion provided directly by Voya. You cannot keep the term policy with NDPERS if electing to convert that coverage. Again, keep in mind, age 65 and over, the only thing you're going to have through NDPERS is if you decided to keep that $1,500 basic policy for $4.32 a month. For further information on life insurance, you can go to our NDPERS website under the Retirement tab and look at insurances. If you wanted to speak to Voya directly, you would want to contact them. I'm going to give one more pitch to our YouTube page. If you go to our home page, there's a couple options. At the top by the search bar, we do have a YouTube tab, or you can go right to our home page and you can see where it says Watch NDPERS videos and event recordings. There is a lot of information for both active employees, retirees, or upcoming retirees on all the information we covered today, and also a lot of other information, even helping to fill out retirement forms, all kinds of things out there. So a really great resource if you just kind of want to educate yourself a little bit more before you're ready to come in and meet with a retirement benefits counselor. If you have further questions, please reach out to NDPERS. You can contact our customer service, and one of our member service representatives would be happy to help you. If you need to set up an appointment, they will also direct you to the correct person in order to get that set up. You can also go to member self-service and log on with your NDPERS account, and you can even do appointment requests on there. Again, our YouTube videos have a lot of information available to you for very specific subjects.